HealthBreak is sponsored by Dignity Health Central Coast.
Hip dysplasia is when your hip socket doesn't fully cover the ball portion of the thigh bone, and it can be painful. An osteotomy is a procedure used to correct hip dysplasia, oftentimes in children and young adults. Dr. Dimitri Delagrammaticus with French Hospital Medical Center explains.
One of the most common osteotomies is called a periacetabular osteotomy. And what we do in that procedure is we make cuts in a very specific way around the socket and reorienting or turning the socket in a different manner so that the mechanics of the hip joint are no longer in conflict, meaning the ball and the socket are not running into each other. The other reason you may need to do this type of procedure is if the socket is very shallow. You can reorient the socket so that you can imagine when you're standing upright, you want the bone to be holding your body up. But if it's very shallow, it may be pushing a lot of load right on the edge of the socket. And so changing the shape of the socket allows the weight-bearing surface to be more broad and take some of the pressure off, often alleviating some of the pain. We try to catch these hip problems early to prevent early onset arthritis or prevent wear and tear of the hip earlier than would otherwise be the case, but really to improve quality of life and to get these patients pain-free and back to doing what they love to do.
For more information, call the number on your screen or visit dignityhealth.org/Central Coast. I'm Kristen Presall.
HealthBreak was sponsored by Dignity Health Central Coast.